Doctors are now warning every senior over the age of 60 about a simple morning habit that could be silently damaging your heart. And the worst part is, almost everyone does it without thinking twice. If you start your day like most people do, you could be putting unnecessary strain on your cardiovascular system before you even leave the bedroom. This is something cardiologists have been concerned about for years, and the research is finally catching up. So please, stay with me for the next few minutes, because what you are about to hear could genuinely change the way you start every single morning for the rest of your life. Let me paint a picture for you. Imagine this. You wake up in the morning, maybe the alarm goes off, or maybe you just naturally open your eyes. The first thing you do is sit up quickly, swing your legs over the side of the bed, and stand up. Maybe you rush to the bathroom or head straight to the kitchen to start the coffee. You have done this your entire life, and it has never caused a problem, so why would you think anything of it? But here is what most people do not realize. After the age of 60, your body does not respond to sudden movement the way it used to. Your blood vessels are stiffer, your heart has to work harder to pump blood, and your blood pressure regulation is not as sharp as it was in your 30s or 40s. That quick jump out of bed that never bothered you before could now be the very thing putting your heart at serious risk every single morning. I am Dr. Charles Anderson, and I have spent years studying how daily habits affect heart health in seniors. What I can tell you from both the research and from what leading cardiologists around the world are saying is that this one morning mistake is far more dangerous than most people think. It is not about what you eat for breakfast or whether you take your medications on time, although those things certainly matter. It is about the very first 60 seconds after you wake up and how your body handles that transition from sleep to wakefulness. Cardiologists at some of the top medical institutions have been publishing findings that show a dramatic spike in heart attacks and strokes during the early morning hours, and a significant part of that risk comes down to how you physically get out of bed. In this video, I am going to walk you through exactly what happens inside your body during those critical first moments of the morning. I will explain why your heart is especially vulnerable at that time, what warning signs you should never ignore, and most importantly, what simple changes you can make starting tomorrow morning to protect yourself. I will also share with you 5 other morning habits that cardiologists say seniors should stop doing immediately, along with easy replacements that are much safer for your heart. So if you are over 60, or if you love someone who is, please do not skip ahead. Every section of this video contains something important. Let us start with what actually happens inside your body when you wake up. During sleep, your body goes into a state of deep rest. Your heart rate slows down, your blood pressure drops, and your blood vessels relax. This is completely normal and healthy. It is your body's way of recovering and repairing itself overnight. But here's the problem. When you suddenly wake up and jump out of bed, your body has to go from that deeply relaxed state to full alert mode in a matter of seconds. Your nervous system fires up, adrenaline starts pumping, and your heart rate and blood pressure spike rapidly. For a young, healthy person, this transition is usually smooth. The blood vessels are flexible, the heart is strong, and everything adjusts quickly. But after 60, things are different. Your arteries have lost some of their elasticity. There may be plaque buildup that you do not even know about. Your heart may not pump as efficiently as it once did. So when you suddenly stand up, your body struggles to adjust, and for a brief moment, your brain may not get enough blood flow. That is when dizziness happens. That is when falls happen. And in the worst cases, that is when heart attacks and strokes happen. Cardiologists call this phenomenon the morning surge, and it is one of the most well-documented risk factors for cardiovascular events in older adults. Studies have shown that the risk of having a heart attack is highest in the first few hours after waking, with a significant peak between 6 in the morning and noon. One landmark study published in a leading cardiology journal found that the risk of heart attack was approximately 40% higher in the morning compared to other times of the day. And a large part of that increased risk comes down to this sudden surge in blood pressure and heart rate that happens when you go from lying down to standing up too quickly. But the real danger begins when you combine this sudden movement with other common morning habits that make things even worse. Let me walk you through the most harmful ones. The first habit that cardiologists want seniors to stop is jumping out of bed immediately upon waking. I know I have already touched on this, but let me go deeper because this is absolutely critical. When you have been lying flat for 6, 7, or 8 hours, gravity has not been pulling blood down to your legs the way it does when you are standing. Blood is more evenly distributed throughout your body. The moment you stand up, gravity pulls a significant amount of blood down into your lower body. Your heart and blood vessels need to react immediately to maintain blood flow to your brain. In older adults, this reaction is often delayed. The medical term for this is orthostatic hypotension, and it is far more common than most people realize. Some studies suggest that up to 30% of adults over 65 experience some degree of orthostatic hypotension. The symptoms include dizziness, lightheadedness, blurred vision, and in severe cases, fainting. But even if you do not faint, that sudden drop in blood pressure can put enormous strain on your heart and brain. Cardiologists recommend that instead of jumping out of bed, you should take at least 2 to 3 minutes to transition slowly. Start by wiggling your fingers and toes while still lying down. Then slowly sit up and stay seated on the edge of the bed for at least 60 seconds. Take some deep breaths. Let your body adjust. Then slowly stand up, holding onto something stable if you need to. This simple change alone could dramatically reduce your risk of a morning cardiovascular event. The second morning habit that is doing more harm than you realize is drinking coffee on an empty stomach first thing in the morning. Now, I know this is going to be controversial. Coffee is one of the most beloved beverages in the world, and I am not telling you to give it up entirely. But here is what the research shows. When you drink coffee on an empty stomach, especially first thing in the morning, it causes a rapid spike in cortisol, which is your body's primary stress hormone. Your cortisol levels are already naturally elevated in the morning as part of your body's wake-up process. Adding coffee on top of that creates a double surge of stress hormones that can raise your blood pressure and put extra strain on your heart. For seniors who already have high blood pressure or heart disease, this combination can be particularly dangerous. Cardiologists suggest waiting at least 30 to 60 minutes after waking before having your first cup of coffee, and always having some food first. Even a small piece of toast or a few bites of oatmeal can buffer the effect of caffeine on your system. And if you are someone who drinks 3 or 4 cups before noon, it may be worth gradually reducing that to 1 or 2 and seeing how you feel. Your heart will thank you. And the third habit might surprise you. It is one that many seniors do every single morning without a second thought, and it has to do with exercise. Now, before you think I am going to tell you to stop exercising, let me be clear. Exercise is one of the best things you can do for your heart at any age. But the timing and intensity of your morning exercise matters enormously, especially after 60. Many seniors have been told their entire lives that morning exercise is the best way to start the day. And while that can be true, jumping straight into vigorous exercise within the first 30 minutes of waking is actually one of the riskiest things you can do for your cardiovascular system. Remember that morning surge I talked about earlier? Your blood pressure and heart rate are already spiking as your body wakes up. If you add intense physical activity on top of that, you're essentially asking your heart to work at maximum capacity when it is least prepared to do so. Cardiologists recommend waiting at least 1 hour after waking before doing any vigorous exercise. Start with gentle stretching or a slow walk to let your cardiovascular system warm up gradually. If you are a morning exerciser, consider shifting your routine to at least mid-morning, around 9 or 10, when your body has fully transitioned to its awake state and your blood pressure has stabilized. The fourth dangerous morning habit involves your medications, and this is something that many seniors get wrong without realizing it. If you take blood pressure medication, the timing of when you take it can make a significant difference in how well it protects your heart. Many people take their blood pressure medication first thing in the morning, which seems logical. But recent research has suggested that for some people, taking blood pressure medication at night before bed may actually be more effective at reducing cardiovascular events. A major study involving thousands of patients found that those who took their blood pressure medication at bedtime had significantly lower rates of heart attacks, strokes, and cardiovascular death compared to those who took it in the morning. The reason is that nighttime dosing helps control the dangerous morning blood pressure surge that we have been discussing. Now, I want to be very clear here. You should never change when you take your medication without talking to your doctor first. Every person is different, and what works for one person may not be appropriate for another. But it is absolutely worth having a conversation with your physician about whether bedtime dosing might be a better option for you. This one simple change in timing could make a meaningful difference in your heart health. The fifth morning habit that concerns cardiologists is skipping breakfast entirely. I know there has been a lot of talk about intermittent fasting in recent years, and for some younger, healthy adults, it can have benefits. But for seniors over 60, especially those with heart disease, diabetes, or high blood pressure, skipping breakfast can be problematic. When you skip breakfast, your blood sugar levels can drop, which triggers your body to release more stress hormones. These stress hormones, in turn, can raise your blood pressure and increase the workload on your heart. Additionally, if you take morning medications on an empty stomach, some of them may not be absorbed properly or may cause stomach irritation. A balanced breakfast that includes some protein, healthy fats, and complex carbohydrates can help stabilize your blood sugar, support healthy blood pressure, and give your heart the fuel it needs to start the day. You do not need a big, elaborate meal. A bowl of oatmeal with some berries, a couple of eggs with whole grain toast, or even a handful of nuts with a piece of fruit can make a tremendous difference. Now here is something that most people have never been told, and it could be the most important thing you hear today. The way you breathe in the morning matters more than you think. Many seniors wake up and immediately start their day without ever taking a moment to breathe deeply and intentionally. Shallow breathing, which is how most people breathe during the stress of daily activities, keeps your body in a state of low-level stress. It activates your sympathetic nervous system, which is the fight-or-flight system, and that keeps your blood pressure elevated and your heart working harder than it needs to. Cardiologists and researchers have found that just 5 minutes of slow, deep breathing in the morning can significantly reduce blood pressure and heart rate. One technique that many heart doctors recommend is called the 4-7-8 breathing method. You breathe in through your nose for 4 seconds, hold your breath for 7 seconds, and then exhale slowly through your mouth for 8 seconds. Doing this for just 4 or 5 cycles in the morning can activate your parasympathetic nervous system, which is the rest and digest system, and help your cardiovascular system ease into the day more gently. It costs nothing, takes less than 5 minutes, and the research supporting its benefits is remarkable. Let me also talk about hydration, because this is another area where many seniors unknowingly put their hearts at risk every morning. After sleeping for 7 or 8 hours, your body is naturally dehydrated. Your blood volume has decreased slightly, and your blood is thicker than it is during the middle of the day when you have been drinking fluids. Thicker blood means your heart has to work harder to pump it, and it also increases the risk of blood clots. Many cardiologists now recommend that the very first thing you do in the morning, even before coffee, is drink a full glass of water. Not ice-cold water, which can cause your blood vessels to constrict, but room temperature or slightly warm water. This helps rehydrate your body, thin your blood slightly, and reduce the workload on your heart. Some doctors even suggest adding a small squeeze of lemon, which can provide some vitamin C and help with digestion. This is such a simple step, but it is one that can have a real impact on your cardiovascular health over time. There is another morning factor that many people overlook, and that is the temperature of your environment. If you live in a colder climate, or if your house gets cold overnight, stepping out of a warm bed into a cold room can cause your blood vessels to constrict suddenly. This constriction raises your blood pressure and makes your heart work harder, which is exactly what you do not want during that vulnerable morning period. Studies have shown that cardiovascular events are more common during cold weather, and the transition from a warm bed to a cold room mimics this effect on a smaller scale. If possible, try to keep your bedroom at a comfortable temperature overnight, or use a timer on your heating system so the room is warm by the time you wake up. If that is not an option, keep a warm robe and slippers right next to your bed so you can bundle up before you stand and start moving around. Let me also address something that affects millions of seniors every single morning, and that is the emotional state you wake up in. If you wake up feeling anxious, stressed, or worried, those emotions trigger the same stress hormones that physical activity does. Your cortisol and adrenaline levels rise, your heart rate increases, and your blood pressure goes up. For seniors who deal with chronic worry, whether it is about health, finances, family, or just the state of the world, that morning anxiety can become a daily cardiovascular stressor. Taking even just a few minutes each morning to practice gratitude, pray, meditate, or simply sit quietly and focus on something positive can help lower those stress hormones and protect your heart. I know it might sound too simple to make a difference, But the research on the connection between emotional well-being and heart health is overwhelming. Positive morning routines that include some form of mental and emotional care can measurably reduce your risk of heart disease over time. Now, I want to take a moment to talk about some warning signs that you should absolutely never ignore in the morning. If you regularly experience any of the following symptoms when you wake up or shortly after, please see your doctor as soon as possible. The first warning sign is waking up with a headache, especially one that is in the back of your head. This can be a sign of dangerously high blood pressure during the night. The second warning sign is waking up short of breath or feeling like you cannot catch your breath. This could indicate heart failure or a problem with your heart's ability to pump effectively. The third is waking up with chest pain, chest pressure, or a feeling of tightness in your chest. While this can sometimes be related to acid reflux or muscle strain, it can also be a sign of angina or an impending heart attack, and it should always be evaluated. The fourth warning sign is waking up drenched in sweat, especially cold sweats. Night sweats can have many causes, but in combination with other symptoms, they can be a sign of a cardiac event. The fifth warning sign is waking up with your heart racing or feeling like your heart is beating irregularly. While occasional palpitations can be harmless, frequent morning palpitations could indicate an arrhythmia like atrial fibrillation, which significantly increases your risk of stroke. If you experience any of these symptoms, especially if they are new or getting worse, please do not ignore them. Early detection and treatment can save your life. I also want to mention something that many of my viewers may relate to, and that is the challenge of sleep quality as we age. Poor sleep is not just an inconvenience. It is a genuine cardiovascular risk factor. When you do not sleep well, your body does not get the recovery time it needs. Your blood pressure stays elevated longer, inflammation increases, and your heart does not get the rest it needs to repair and maintain itself. Common sleep disruptors for seniors include sleep apnea, which causes you to stop breathing repeatedly during the night, restless leg syndrome, frequent urination, and chronic pain. If you are not sleeping well, it is worth talking to your doctor about it, because improving your sleep quality can have a profound impact on your heart health. There are many effective treatments available today that can help you get the restorative sleep your heart needs. Let me pull all of this together with a simple morning routine that cardiologists recommend for seniors over 60. When you first wake up, stay in bed for a moment. Wiggle your fingers and toes, take a few deep breaths, and let your body start to wake up naturally. After about 30 seconds, slowly sit up and stay seated on the edge of the bed for at least 60 seconds. During this time, you can practice your deep breathing or simply sit quietly. When you feel ready, slowly stand up, using your nightstand or bed frame for support if needed. Head to the kitchen and drink a full glass of room temperature water. Then, take 5 minutes to sit quietly and breathe deeply, practice gratitude, or do whatever brings you a sense of calm. After that, have a light, balanced breakfast. Wait at least 30 minutes to an hour before having your coffee. And if you plan to exercise, give your body at least an hour to fully wake up before doing anything vigorous. Start with gentle stretching or a slow walk and gradually increase your intensity. This routine takes maybe an extra 10 or 15 minutes compared to what you might be doing now. But those 10 or 15 minutes could be the most important investment you make in your health every single day. Your heart has been faithfully beating for you every second of every day for 60, 70, 80 years or more. It deserves to be treated gently in the morning, and these small changes can help you protect it for many years to come. I want you to know that I share this information not to scare you, but to empower you. Knowledge is one of the most powerful tools we have when it comes to health. By understanding what your body needs and making small, simple adjustments to your daily routine, you can dramatically reduce your risk of heart problems and enjoy a longer, healthier, more active life. These are not dramatic changes. They do not require expensive equipment or special diets. They are simple, practical steps that any senior can start doing tomorrow morning. If this information was helpful to you, I would truly appreciate it if you would subscribe to this channel. I create these videos because I believe every senior deserves access to clear, honest health information that can make a real difference in their lives. By subscribing and turning on notifications, you will never miss a new video, and together we can build a community of seniors who are informed, empowered, and taking charge of their health. Share this video with someone you care about, because you never know whose life this information might save. Thank you for watching, and I will see you in the next one. Take care of yourself, and please, take care of your heart.